Well, just this week, the FDA released new COVID vaccine guidelines it hopes will simplify your next round of shots. The agency says most people just need a single dose of the most recent Moderna or Pfizer bivalent booster. Meanwhile, there's a new UNICEF report that found tens of millions of kids in the U.S. and around the world are just not up to date on their routine vaccinations. The official end of the national COVID public health emergency is just weeks away at this point, and the question, have Americans really moved on from COVID? And are they likely to ignore vaccine recommendations now and into the fall? So joining us now to discuss, NewsNation medical contributor Dr. David Montgomery. Doctor, it's good to see you. Thanks for being here.
Yeah, great to be with you.
And it's a big topic. I mean, Dr. Montgomery, there's a study from Pew Research showing that public confidence in our health agencies and in science at an all-time low after the pandemic. And we know the guidance is ever evolving from our health agencies. But with the FDA saying, actually, do you know what? Maybe not 2 boosters, maybe just 1 at this point, and then we'll wait and see in the fall. Does this just continue to erode that confidence?
Yeah, we've been sort of seeing this erosion of confidence in the scientific community for a long time. When COVID hit, we really saw it laid bare. I think what we should do is, at this point, make as simple as possible the recommendations, but not just that, Natasha, but to explain why the changes have occurred. And I think that was one of the big gaps throughout the entire pandemic is the messaging. We didn't talk about why new information, when we got new information, I should say, came in, why we were changing the recommendations and why we should do different things. I think that was part of it.
That's really interesting. And it seems at this point, it's become so politicized and so divisive. It's not even about the science anymore. It is really stark and it's about party lines. Are you worried about how our country will respond in the case of the next pandemic?
Yeah, well, I think it's always really been about the science. I think we in the scientific community haven't sort of taken that narrative and said it is still about the science, no matter what the sort of surrounding environment is like. I do think that the next time that this happens, I think we have an opportunity to do a lot better with this, right? So we get to say, here's what we've learned from the previous pandemic, and here's how we're going to approach the next. I do want for everyday Americans to be a lot smarter about this. And I think just by definition, we will be, and start to think about how they're going to protect themselves. I say this still to my patients now. I want you to develop a strategy for you and your family based on your own unique sort of medical characteristics about how you're going to get through the rest of, COVID-19. It's not gone yet, Natasha. And how you might get through the next pandemic if it were to come in our lifetime.
I appreciate that. And, I know you're a cardiologist by training. I'm interested, we are seeing effects from COVID and long COVID that are really vascular in nature, that really do affect the heart. And I wonder, in your practice, are you seeing otherwise healthy individuals with pericarditis, with heart problems after COVID? And is this still a reason to keep up to date with vaccines, even if people are not worried about COVID potentially killing them?
Yeah, that was part of my message sort of when the pandemic first started. We saw that the original sort of ancestral strains and then Delta were first lung problems, then it became a cardiovascular problem really quickly, even in people who didn't have any symptoms of it. And so that was one of the reasons why I was touting, hey, get a vaccine. I think right now what the CDC is saying and the FDA are saying, they're saying, listen, the people who are still having trouble from COVID-19, as it sort of fall into the background for most people, are the people who are immunocompromised and the people who are older than 65. Those are the people who are still being hospitalized, 1,700 people a week still hospitalized from COVID-19. And about 170 or 190 people dying still from COVID-19. These people are made most of that number is made most of the people who are immunocompromised and the people who are 65 years of age. And while we're not seeing a lot of cardiovascular disease now in response to the current subvariant of Omicron, we still think that there are some people who have a lot of long-term fallout from the disease. And so we still want people to be smart about protecting themselves, and then smart about protecting the people who are most vulnerable.
Yeah, and Dr. Montgomery, we're almost out of time, but in just 10 seconds. So the idea, if you haven't gotten your booster, your bivalent booster, get it now. And is the hope that there will be a new one in the fall that will be tailored to whatever strain is plaguing us in that moment?
Yeah, well, still left to understand what boosters are going to be next. I don't have a blanket recommendation for everybody. Talk to your doctor about if it's the right thing for you.
Okay. Dr. David Montgomery, thanks so much for your time.
Great to be with you.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.